with that, I just want to remind you that we do have a resource page set up, socialmediahit.com, that has all of the slides on there. I know they're hard to read, they're small, we're going very quickly. Folks that are looking on the Ustream and so forth, please do go to that site. All of the presentations are posted there, as are the titles of each of our distinguished panels and their bios. And we look forward to doing a number of these briefings. And with that, in the interest of time, I will stop talking and turn it over to Andrew. So thank you.
Sure. Good morning, everybody. So we obviously in the first panel we saw a great case study of how these social media tools can be used in public outreach and public engagement. So, but what I want to do is talk about this from a little bit of a different perspective and step back a bit. And to do that, and the reason why I'm doing that is because a little bit where I'm situated organizationally within HHS. So I'm in the Office of the Secretary, in the Assistant Secretary for Public Affairs in the Web Communications and New Media Division. And what that means is that if you think of sort of a hierarchy or an org chart, Office of the Secretary is at the top, below that is CDC, NIH, FDA, Indian Health, and so forth. Sort of a very top-down approach. And being in the Web Communications and New Media Division, what traditionally that would mean is that we help provide guidance and leadership across the department for initiatives in the web space. Certainly, all the agencies do a lot of stuff independently from us. They do a great job, obviously. Sanjay and Aaron are great examples of that. But overall, we do provide guidance there for what's going on in the department. Just to sort of step back as well, just sort of give you a quick bio of what I do personally. I'm responsible. One of my responsibilities is the management of flu.gov. I'm also a member of the leadership team for our Center for New Media at HHS. So now, looking at that traditional structure of a sort of a top-down approach, of a hierarchical structure of how you approach management, now in this new space and these new social media tools, really, for me, that structure, that sort of top-down structure no longer is effective and really doesn't work. And we have to come up with new ways of looking at organization. We have to fundamentally reevaluate not only how we engage with the public using these tools, but how, by using these tools, are we going to be forced to react and act differently organizationally within our own structures. So what I'm going to do is talk about one of the challenges in doing that. Craig did a great job of highlighting some of the challenges this morning using social media. I'm going to talk more about how we as a department need to do a better job of getting the information out about using these tools and how they can be used. These tools can be used effectively and be mission-oriented in a way that everybody's going to benefit. Obviously, in that first panel, you heard some great information from Aaron, great information again from our rocket scientist, David. You're going to hear some more information from Sanjay in a second. But the question is, how do we get that information? How do we get those tools, that resources, that knowledge out across the department? Just Robin alluded a second ago, how do we get to those people that might have disabilities? How do we get to those people that might be in Indian Health Service, they're out in Arizona, they're somewhat isolated? How do we get the expertise out to them? And that's one of the real challenges of using these new tools. So that's where actually I think the Center for New Media that we have within HHS can play a really valid role. We don't have all the resources to be a support structure for new media initiatives across the department, but what we can do is serve as a platform for discussion, serve as a way to foster communication and collaboration across the department about using these new tools. How can we get people that are out in the field access to people like David and this information? How do we get Erin and her team connected to the people that are out in the field as well and share that information across the department so we are able to adapt and respond more flexibly and agilely to this evolving environment? Things move so fast. If we use the traditional model of something happens, somebody has a good idea, again, David, for example, in NIH, NLM, traditionally, he does a good job, maybe it percolates up to the Office of the Secretary, we look at it some more, and it percolates down and gets tried out in some other areas. That model is no longer working anymore. We have to find ways to make these connections laterally, horizontally across the department. That's happening a lot of ways organically right now. My first interaction with David was actually, the first time I found out about his project was over Twitter by accident. I met David by accident over Twitter, and I have some other good examples of where that's happened with me across HHS, but across the federal government, where I've made connections using these social media tools to further our mission and further the objectives we're trying to achieve. But what we really need to do is not just do that in this sort of organic, hope it happens method. We have to do this in a way that's going to make it systematic. It's going to be baked into the process, that everybody is going to be connected, and we can pass ideas and share information, share lessons learned, best practices in a real-time way. So again, for the Center for Social Media, Center for New Media in HHS, the way I see, I'll give an example, a quick example of how I see this evolving and actually happening. Several weeks ago, we put a call out, sort of very low level, to a few people we had contacted in the department that were interested in new media to talk about Facebook. You might have known the White House and GSA recently signed a terms of service agreement, so now basically we can legally use Facebook as federal government entities. HHS itself just signed that agreement this week. But there's a lot of, just because you can use it doesn't mean you should use it, doesn't mean you know how to use it correctly, doesn't mean it's going to align with your mission. I mean, Erin and her team does a great job of looking at how these tools can be used, looking at the data, how can we reach out to target audiences using these tools and do them correctly. So now we have this agreement. We need a group of people. We need this team that we're going to try to put together, that we contacted through this listserv, to talk about best practices, talk about lessons learned, to talk about metrics, evaluation, all these different kinds of things. So we put out this call to this listserv we created. Again, it was only about 100, 125 people that we contacted. Within 2 weeks, we had 50 people from across the department get in touch and say they want to be involved. And it wasn't just people in this area here. It was people from across the department. It was FDA, NIH, lots of people from IHS, Indian Health Service, and not just here in the DC area, all across the country. So to have all these people now being tied together, you're going to be able to start building a team of experts, and not just a team of experts that know these tools, and again, then they're going to be siloed again in their own little area, but it's a team of network experts across the department, and even more broadly, start networking with people across the federal government that's going to be able to use these tools and respond in an effective way. And there's two benefits that I see to this. One is that we're going to be able to respond in a much more targeted and effective way, and our reach is going to be much better, because just because CDC or FDA or the Office of the Secretary puts out an initiative and wants to get the word out, that doesn't mean we're going to know the best messaging and we're going to know all the targeted audiences might potentially be out there. If we have people in Indian Health, again, for an example, they know their target audience, they know their stakeholders. If we can have people in those areas that they can be the ones getting this message out, they're going to do a much more effective job than we can from just one centralized location. And again, so that's reach. That's one of the real benefits of having this team of experts, sort of a network team of experts out there. The other good part about this is the ability to respond. Being out in these spaces and being involved with these conversations, by paying attention to what's going on, you can see trends, you can see emerging issues. Some of this might be enhanced by some of the work that's David doing, or some of the natural language processing or other kind of monitoring tools. But it's hard to beat having a person out there who's actually listening and being engaged. As part of my experience with pandemicflu.gov and now flu.gov, I ran the Twitter account for that site, at bird flu, now it's at flu.gov. I had, via that account, started building some relationships with people that were interested in that and had some really good information about pandemic planning and preparedness. So when the news broke and when we started ramping up with these 10,000, 12,000 tweets per hour, I didn't have to necessarily look at all that noise. I could go to the people who were already engaged in these conversations. I knew who they were because I already had a relationship with them. Again, expand that out to having people all across the department being able to have these targeted, directed conversations with people they know. It's very powerful. The last thing I wanted to say is that this is only one of the challenges. There's lots of challenges. Craig did a very good job in the beginning talking about some of the real challenges moving forward with government using these new tools. I mean, if you open it up for comments, if you get 100,000 comments, what do you do with that information? It's a real challenge at some point, and David talked about this as well. You can do some natural language processing or use some automated tools, but at some point a person's going to have to look at this, and that takes resources. The other challenge we was alluded to in one bit, but I wanted to reemphasize it because it's an important one. The idea of spreading misinformation or disinformation on these tools. There was a really good example when Michael Jackson passed away recently. There were some people out there actively going out and spreading misinformation, disinformation about other celebrities who had died. Seems pretty innocuous. But if you think about it in the context of a pandemic or other kinds of areas where people actually are spreading disinformation for terrorists or for whatever it might be, that's a real problem. That's a serious issue. There's a gentleman named Jack Holt in the Department of Defense who does a lot of their social media work there who always talks about this. So there are other challenges out there that we have to do, But really, this networked idea of connecting people and empowering people all across the department, and more broadly, all across federal government, I think is one of the ways to handle those challenges.